For now, I'm going to ask you, Sally. You have been listening for a long, long time, and you have heard a lot of political aspirations, a lot of scientific achievements, and you have also heard the reality check as we have really gone to the ground and to the practice. And I know you're following the situation very, very keenly in Africa, and it's a great honor really to have you, Sally. And thank you for being here, and the floor is yours for some short reflections on what we've just heard. You're on mute.
Thank you very much indeed, and congratulations on organising this webinar, Marion, and also many thanks to everybody who's taken part. It has been really fascinating to listen to what people have to say. What I want to do is to provide some comments on the insights that people have given. I'm very conscious that I'm not from Africa. I'm also very conscious that unfortunately, much to my regret, the UK is no longer a member of the EU. But as a former MP and International Development Minister, I take a huge interest both in what's happening in Africa and also in Europe. And it seems to me there have been some very strong, clear messages coming out of what we've heard today. Firstly, on the positives from the chairman who opened, Fortune Chirambira, we heard about the need to move from collective helplessness to collective inspiration, which I thought was a very good summary and way of and good vision for the meeting. And we also heard about some of the very excellent technical developments at the universities, in particular around data collection and handling and ownership, about reverse linkages from Kampala International University, and also from Professor Oladipo from Lokoja University. And we also heard from Dr. Reginald Nadagala about the importance of looking at the values as well. So we heard a lot about the positives, but if there was one theme which really came out, particularly in relation to COVID, it was the way that the COVID epidemic has followed the fault lines of inequality within our societies and between our societies as well. And that was spelt over and over again, in particular by Dr. Leva Franson, who talked about the inequalities between health professionals, between the numbers of health professionals, treatment of health professionals, the access to medicines. I would just like to add in one further inequality, which I found when I was thinking about this webinar. There's a report in the UK, produced by the UK Parliament, that says it in total, the United Kingdom has spent just on the COVID epidemic alone between 426.5 billion US dollars and 555 billion US dollars. That's in terms of livelihood support, economic support, as well as spending on health systems. That's billions of dollars. That's more than the total government spending of any of the sub-Saharan African countries. I mean, it is a phenomenal amount of money, and the spending on track and trace alone was something like 50 billion US dollars, which again is more than most entire government spendings. And I think that that is a measure of the scale of the inequalities between some of the European, and I use the word in its more general sense, nations, and between the resources that are available to some of the African nations. And I think perhaps put some things in context. But looking at the inequalities also, one of the most striking ones was how the epidemic finds the fault lines. And the biggest fault line that we've heard, perhaps, apart from poverty, is also security. And the testimony that was provided from Ada Hospital in Tigray was absolutely searing. I understand that at that hospital recently, some 60% of the staff, perhaps the Dr. Emmanuel would like to correct it, but I understand it was something like 60% of the staff tested positive for COVID. And that underlines the kind of remarks that were made earlier about the lack of vaccination, even for health workers who are right at the front line of treating people. And we heard also from Dr. Asma Ali, for which thanks very much for your short presentation, but very, very powerful, about the impact that the COVID epidemic had on already marginalized communities, in particular women and children, who so often are the people who are hardest hit. The impact on girls of not being able to go to schools because schools are shut. And I think that was a really telling statement. Now, I'm very conscious about the pressures on time, so I just want to say that coming on from there, we then heard also from civil society about what some of the ways to resolve the inequalities are. We heard from the Ahmed El-Zabir from Sudan Civil Society about his concern that one of the root causes, or one of the prime ways to resolve the difficulties, is by improvements in governance. That was also a point that Professor Ronald de Jong was making as well. You know, be the change that you want to see, very much paraphrased. And I think that brings us right back to this conference, which is between two of the biggest blocs which are concerned about governance in the country, Africa Union and the European Union, that between them can look at some of the big issues of governance. It will realize the potential that we've heard from so many of the speakers in this conference, and also tackle some of the challenges so that we can see a resolution to what's happening in Tigray, and that people there can see a lifting of the blockade and the services that they so badly need, and that the women and children that Dr. Ali talked about can also get back into school, and can see improvements to their long-term future. So, I think in terms of holding out the potential, the capabilities and the challenges, this has been a very powerful and helpful conference. And I hope it will also, that some of the messages that have come out of this will also run right through your discussions between the African Union and the European Union. Thank you very much.
Thank you, Sally. And what a beautiful and important summary, really, of what we have been discussing. And it just makes me aware of how much we miss you in the EU. And actually, I can't really wait for the time that we will be able to welcome you back, Sally.